Back in 1991, we proposed a study of non-Aboriginal children that Healthway funded. That study was called the West Australian Child Health Survey, and it was an extremely successful pioneering survey of mental health in non-Aboriginal children, and one that, as we started, we had worked with Aboriginal people and leaders in the state to say, what should we do about sampling Aboriginal children? And they said, do it properly, bring to us what you do for your mob, and we'll make a decision about doing something for our mob. So we did that initial study on Healthway funding way back in 1991. It was a 3-year tranche of funding, went back, and I think the mob was okay to sort of say, all right, let's take a shot at doing a proper study of Aboriginal children across Western Australia. So in 1999, we put an application into Healthway for what became the West Australian Aboriginal Child Health Survey. That was given funding, and it was with that funding that we were able to start to convince people, literally, because Healthway could step in with a good amount of funding. It was a competitive process. We were successful in doing that, and it gave us as a team credibility.
It's a platinum standard. There's nothing like it I've ever seen, and I've seen a lot of research. In terms of its scale, in terms of its process, it sets the standard around how do you do really effective, powerful, owned research with Aboriginal communities.
This was ultimately an 11-year project from go to woe, during which Healthway stepped in a variety of ways to assist funding for both, originally the actual creation of the data themselves, but then because we're always reporting to Healthway on how we're going, what we're doing, and very mindful of the health promotion aspect of it. And that was critical because the kind of differences that needed to be made for Aboriginal people were differences in lived lives. They were differences in the way that governments, non-government organizations, and industries thought about the way Aboriginal children and families were growing up. There was a terrific need to change what policy in education, health, and welfare community settings were thinking about and able to do. So this set a whole new standard.